All right, we will get started and folks can join and or watch the recording later. Thank you for those of you who have taken time out of your busy day to join our panel discussion with 4 of our recent Skillings and PH alums. So today's topic is design thinking in public health. And we want to welcome Jared, Margaret, Marlene, and Emily. And I will not have this PowerPoint up full screen for the duration of today's discussion, but want to make sure that we at least share the agenda for today. We will go through an overview of design thinking, have the panel discussion, offer Q&A with the audience, and then end with information about our Spring 22 course on design thinking for the public good. And so I'm first going to introduce myself and my design thinking fellow, Macy Rush. And so my name is Liz Chen. I'm an assistant professor in the Department of Health Behavior at Gillings. And I'm also the CIPG, or Certificate in Innovation for the Public Good Director, and teach the required course in that certificate called Design Thinking for the Public Good. And today, Macy and I will be co-facilitating this panel and invite you all to participate by commenting or entering questions in the chat that we can elevate to our panelists. And first thing we wanted to do was just to make sure we had a common language and understanding about design thinking for those of you who are newer to this field and phrase. And so design thinking is a human-centered approach to problem solving and innovation. It is 3 things. It's a set of mindsets, a methodology, and a process, as well as a set of tools. And we use this picture of ice cream to remind ourselves that there are multiple flavors of design thinking, meaning that there's different schools, including Stanford's D School, and different companies like IDEO and Frog that have their versions and their processes and methods. However, if you look at all of these processes and essentially do a content analysis, you'll see that many of them have overlapping themes and categories. And so we train in IDEO's version of design thinking, and they use this graphic to showcase the 3 major areas of focus that design thinking facilitates us to think in. And so the first piece is desirability, which I think public health is getting better and better at. So what do humans want, whether they are community members, patients, other stakeholder groups, providers? What is it that they want and need? The second piece, feasibility. So within current time, resource, cost, and people constraints, what can we accomplish? And then the third, which is I think the piece that in public health we would benefit the most from using some frameworks and tools from design thinking, is this viability or business piece. And so how likely is it that this solution will be able to sustain itself in the real world? We spend a lot of time and get funding for small and sometimes big projects through seed funding and investments. And we test it usually under ideal conditions. And so what does it look like for our products and interventions and services to actually be tested in the real world? And will they sink or float? And design thinking is really good at making us think through all 3 of these different buckets to find the sweet spot of innovation in the middle that meets all 3 of these conditions. And so design thinking is not new. It comes from many different fields, including computer science, visual design, architecture, and business. And IDEO specifically has been involved with using this process to design a lot of products in the business world. And so Palm Pilots in our iPhones, Oral-B toothbrushes, the original Apple Mouse, and Fitbit, all examples of products that have been designed using design thinking. And we want to highlight that in addition to physical products, design thinking can be used to design services and interventions that we more think of when we think about public health. And so IDEO a while ago partnered with Bank of America when Bank of America realized that their customers kept saying to them that they wanted to save more, but in practice were having a hard time doing it. And so IDEO went through the design thinking process and then came up with the Keep the Change campaign, where for every customer that was signing up for a new checking account, they also automatically got a savings account. And every time they swiped with their debit card, it rounded up to the nearest dollar. And the difference between the purchase and that nearest whole dollar got deposited automatically into the savings account. So that was very popular. IDEO also recently worked with LA County to update the voting experience for those going to the polls for the 2016 and 2020 elections, knowing that there's over 100 languages spoken among voters in that county. And then other products like Spotify continue to use design thinking to create and update their product. And so earlier we mentioned that design thinking involves mindsets. And so here are the 7 that design thinkers are trained in. And again, these are mindsets that are not innate at birth, but are things that we continue to practice. And the 2 that I see faculty and students struggle with the most, and the ones that we try to spend the most time on, are 3 and 5. So this learn from failure and embrace ambiguity. And there are tools, some of them free, including the Field Guide to Human-Centered Design that's available for download on the IDEO website. And want to just highlight that design thinking is different from traditional problem solving, especially in public health. So on the left-hand side of this picture, oftentimes we have problems, they're handed to us, whether it's by a funder, a community group, or your boss. And you take all of that information and are expected to generate the one perfect solution. And that doesn't always work. And so design thinking still takes all those inputs and all of that information initially presented about a challenge, and then asks you to explicitly go backwards to further understand the context, the problem, and people's lived experiences first. Add that knowledge to the bucket that you have, and then move forward to test multiple solutions, knowing that you're likely not going to only be able to test one and find the right fit on the first try. And so in general, across the university, we want folks to build skills in design thinking because we want, especially our public health students and faculty, to develop deep understanding of problems and focus on meeting genuine human needs, create space and time to explore multiple options, to place small bets fast through prototyping, and then emphasizing collaboration and diversity. And so at this point, we are going to transition to our 4 panelists. And I'm going to ask that each of them takes turns. So we're going to go Jared, then Margaret, then Marlene, then Emily, and introducing yourself, the year you graduated, and the concentration that you graduated from. And then also answering the question, when did you first learn about design thinking? And then that'll kick us off. And Macy and I will continue to monitor the chat for folks as if you want to ask additional questions. So again, Jared, maybe keep it to 2 minutes max so we make sure we have time for everybody and for other questions. Just your intro info, and then also how did you first hear about design thinking?
Awesome, thanks Liz. So hi everyone, my name is Jared Bishop. I just graduated last May, so I guess 2021, with my MPH in health equity, the new concentration. And I actually found out about design thinking through an internship, actually working with Liz about fall of 2019 when I first started. I knew a little bit about design thinking through my past qualitative research, but didn't know too much about it. And thankfully, Liz kind of took me under her wing and really introduced me to the vast world of design thinking. So it was really exciting being able to work closely with Liz and continue to grow and learn more about design thinking and turn that into one of my positions I have now, which I'm sure we'll talk about later in our conversation today. But thank you everyone for coming, and good to see everyone.
Thanks, Jared. Margaret?
Hi everyone, I'm Margaret Benson-Nimitz. I use she, her pronouns. I am health behavior class of 2020. And I first learned about design thinking in a class from Liz, her evaluation course, her first semester teaching it. And we just had like 1 unit on it. And that was my first time formally hearing about this process.
Thanks. I'm like, maybe we should go to a different question, but Marlene, next.
Hi everyone, my name is Marlene. I am also class of 2021, so I graduated in May from the health behavior concentration. Liz was my faculty mentor. And so from when I first started my program, I heard a little bit about the work that she did, and always found it intriguing. And when I had the opportunity, I learned more about it. And I'm sure we will talk about that later.
Thanks. And Emily?
Hi, I'm Emily. I graduated in May of 2021. What year is it? May 2021 from Health Behavior. Also found out about design thinking from Liz, but had been searching for a better way to solve problems, and was really interested in something that was human-centered. So first learned about systems thinking in a guest lecture as part of the MPH core, and then was connected to Liz after that.
All right, thanks. I did not anticipate that was the answer. Otherwise, I might not have asked that question. We will transition to a question that will hopefully allow you to share more about the work that you are doing right now in your current roles. And so how have you all used design thinking in your public health work? And we do not have to go in the order that we just went in, but if you would like to go, feel free to unmute yourself. And again, try to limit your responses to 2 minutes so that we make sure we have time for everyone to answer.
I don't mind going first. So I had an opportunity when I was at UNC to do some design thinking consulting through the fellowship through Innovate Carolina. And so I was able to work with folks who were doing public health research, some research that was kind of on the periphery of public health. A lot of things are public health, even if they aren't directly. So I was able to do some consulting using design thinking. And now I'm working for a boutique consultancy, and we work with some nonprofit clients who are working in the public health space. So I'm working with them on design thinking and strategy and creating solutions that are more human-centered.
Thanks, Emily. Jared?
Yeah, I don't mind going next. So my current research assistantship position actually is poised to do design thinking activities. So we are hosting design thinking activities with caregivers of children ages 6 or younger. And I've actually been able to do those design thinking activities virtually. So that was really interesting when starting that position, working with the pandemic, and kind of molding and shifting everything I learned about design thinking previously and trying to adapt that kind of on the fly with the rest of the world to doing it virtually, which ended up being pretty successful. I'd like to say we learned a lot about what works, what doesn't work, but it really shows how adaptive people are and how design thinking can help mold those spaces to make people still feel welcome and comfortable in that virtual setting.
Jared, thank you so much. In my intro, I wasn't able to go in depth about the process and then the specific methods. So I was wondering if you could give an example of a design thinking activity that you did with folks on your project virtually, and then the purpose of that specific design thinking activity.
Yeah. So I guess one that we used pretty commonly was journey mapping. So we did empathy mapping and journey mapping, but kind of closing things out with journey mapping. So journey mapping kind of shows a process of what you're looking to do. So for us, it was kind of a journey to a grocery store. So folks mapped their journey from beginning, during, and after the grocery store. And through that journey map, we kind of learned about different happy points, pain points, points where they might be open to any kind of intervention, points where they might be closed off. And kind of through that learning from what they told us, we were able to shape the intervention, either the location or the intervention itself. So it could be catered to what they would like and what they wouldn't like. Short answer, but yeah.
Yeah, thanks, Jared. And I'll just highlight that journey mapping is a great tool. Oftentimes in public health, we're so focused on creating the product or the service in isolation, we forget that we're going to implement in a real world where we have to think about how people come to learn about this intervention or product. And then after they use it for the first time, what do we expect them to do with it after? And so journey maps are really great to imagine and think through what the experience is like for the whole journey with participants and stakeholders. So thanks. And then Margaret, Marlene, don't know if one of you wants to go next.
Can happen. So I work with the North Carolina Institute for Public Health on our accreditation program. At least that's part of my responsibilities. And last year, we went through our first ever strategic planning process after the program had been running for over 15 years. And so it was a great opportunity. We kind of used more human-centered design to think really big and broad about like, what is our inspiration? Where might we be able to go? How might we do these different things? How do people see our program? And really talking to people who are the end users of our program. So really centering their voice and their hopes for the program in that strategic planning process that we're now implementing. And through that whole process, we were able to get a lot of really great ideas that informed a design thinking process that we're currently doing with 6 health departments across the state who applied to join us on this design team, where we're now testing different prototypes for quality improvement for health departments. And it's been a very exciting process. We met with them this morning to continue to tinker and play with our different prototypes. And it's a whole new world for them. And it's been a learning process for us, like Jared was saying, to facilitate all of this online in the COVID world. And it's been so much fun.
Thanks, Margaret. And Marlene?
Yeah. So my main role, I am a program manager for a COVID response program in Durham. So I manage a team of community health workers who are going out every day, providing access to information, vaccines, testing, whatever it is that the community has needed throughout the pandemic. But as part of that, my program is funded by the City and County of Durham. And in this past year, the City of Durham was selected as one of 50 finalists for the Bloomberg Global Mayors Challenge, which is essentially an international design thinking project. So Durham submitted a proposal and they were selected as one of 50 finalists. And I was asked to be on the core team for this project, which is this was back in like June, July. They reached out to me and we have essentially been refining this proposal by using design thinking methods in order to submit a refined proposal, which just happened last week, actually. So it's essentially, we submitted a grant. And if we win, there are going to be 15 finalists selected. If we win, then the City of Durham will receive $1 million in funding for the program that we designed.
Thanks, Marlene. And then can you also give an example of a design thinking activity that you used to refine the grant proposal that you just submitted?
Yeah, so, and I will say there are like terms in design thinking that I don't remember off the top of my head, but this has been an iterative process throughout. So we started with key stakeholder interviews to get a sense of what it was that the community needed and to give a sense of the project. We were working with specifically community health workers, which is how I became involved in this project, and trying to make the connections between local government and the resources that they have to the people in the residents in the community that need them most. So there's a disconnect between, you know, especially during COVID, there's been a lot of additional funding opportunities that have come down from the federal government, but it's not always easy to connect those resources to the residents who need them most. It's just where the community health workers are really in a space where they've already made this connection. They are already trusted messengers for their community, but even they have trouble navigating the systems that are coming down from either local or federal government, you know, where these resources live. And so we started off with in-depth interviews. We worked with a graphic designer at that point and actually created storyboards, kind of walking people through what we thought could work to address some of the issues we were hearing from community health workers. From there, we had a survey that went out to different members of the community and also to individuals in local government, and then actually did a 2-week prototype on a WhatsApp. It was a virtual community of bilingual community health workers to try to test out some of the things we had come up with.
Thanks, Marlene. And then for those of you who are not familiar with the word prototype, when we use that word, we're referencing like a rough draft of a piece of an intervention or product. And so instead of investing initially to create something really techy and beautiful especially in this initial phase of iterative testing, we often use PowerPoint, drawings, storyboards to try and convey ideas and put it in front of people and let them react to it and co-create alongside us. So that is what we mean when we say prototype. Okay. And then the next question that I have for our panelists, and some of you have started to talk about this, is how is design thinking similar to or different from methods or approaches you learned in your MPH training?
I can start that one. So I listed off a lot of the things that we did, but really the training I got in qualitative and quantitative research methods, you're using those same skills just within the frame of design thinking. So interviews and surveys, those are all things that if you take any qualitative or quantitative research classes, like you're going to be learning about creating those tools and analyzing them and, asking the right questions. I think something else I used and I found myself thinking about a lot was I took a mixed methods research course from the School of Education, and I found myself thinking about what I learned in that class a lot, because you're using, at least in our process, we were using a combination of like it wasn't just qualitative data, it wasn't just quantitative data. And when you're thinking about using those together, there are ways to think about how is in this iterative process, how is one thing going to build on the other? How can we, design this order strategically to be able to work towards, our end goal here?
I'll chime in. I really like that comment, Marlene, about mixed methods, because my work has involved a lot of summarizing of just facilitated conversations, but then you're also doing card sorts and voting and kind of getting counts on some of these ideas that come up and then merging those ideas. And it's very similar to what I learned in qualitative analysis, and also kind of how do you take different sorted data and analyze it and not just say like, oh, this one got the top pick, so that's their answer, but really looking across how did those different votes span across the different options, and what else can you think about? One of the other big things about, or a difference I see with human-centered design is it's, at least in the way I've used it, feels like it's less researchy. And it's more of like, yeah, we have this idea, we're trying to come up with a solution that's real world, that meets our health departments where they are. I work almost exclusively with health departments, and some of them like to be involved in research, but they're often not. And they're often really, they're practice-based. Our whole team is doing practice-based public health. And I think human-centered design has been really useful for them, because we're trying to design like tangible products and tangible tools for them to use in their day-to-day. We're not trying to write some research article. Not that you can't use human-centered design and design thinking to write research articles, but it's been a pretty approachable method for us to use on the ground in a way that some more formal community-based participatory method processes can feel a little bit more researchy. Though I do see so much overlap between community-based participatory methods and human-centered design. I also see so much overlap between just strategic planning processes and design thinking. That's kind of how I got into this whole space, is through strategic planning. And I read strategic planning books, and they're saying the same thing in a lot of ways.
I can add to, I think one thing I've really enjoyed specifically about design thinking, I guess kind of compared to some previous qualitative work, has been the intentionality behind the activities and the structure of the settings, kind of like Marlene mentioned earlier. I think throughout some of my work, we've been able to see the groups we've worked with grow as each session has gone by, and also see how the activities that we implement kind of directly correlate to some things that we might not have discovered otherwise if we asked just a regular verbatim question. How like integrating a specific activity might uncover a different theme that wasn't in a question you could ask, but it might naturally guide the conversation there. And all of a sudden you have another point to build on that is vital to whatever your intervention is, but may not have come up in everyday discussion. And I think some of those activities specific to design thinking not only kind of get at some of those behind the scenes themes and thoughts that people have, but it also really does bring people together. I think we found that some of those activities, being able to not only do it, but also have the space to talk to one another about how you're feeling or your reactions to a certain prototype, to a certain question, looking at other folks' journey maps, I think is really unique to design thinking and has been really important in my work.
I agree with what everybody has said. And I think what we're hearing here is that design thinking is not all or nothing. So there's ways to embed the activities and the mindsets and the practices of design thinking into the work that you're already doing. There's a lot of clients that I work with, especially small nonprofits that might not have the funding or the resources to be able to do an entire design thinking process. It doesn't mean that this is something they can't access. So we're able to do just maybe one activity that's already embedded into their research process, or we're able to test a really low fidelity prototype rather than launching at scale, maybe a pilot. So you can pick and choose parts of design thinking to embed, and you're still getting a little bit of this focus on testing things early and getting insights that are more advanced than just a standard research question.
Thanks, all. I am going to ask one of the questions that Una posed in the chat earlier. And so she wrote, design thinking seems pretty common sense, but when you started studying it, what was the most difficult part of this process or framework or thinking?
I think probably, and Liz, I don't know if you had it in this slide, but I know you've had it in other slides, the divergent convergent thinking. So basically the deep thinking and the big picture thinking. So I think having that kind of ingrained into your design thinking process can be kind of difficult sometimes, because it's really easy to get stuck in the details and want to always hammer down the details as quick as you can. But I think design thinking does have the structure to kind of encourage you, or if not, make you take a step back and evaluate again and make sure you are on the right track before you keep diving deep into something that you might have found but might not be a true solution. And I think that divergent convergent thinking brings everything together, both in your findings and also brings the folks you're working with together, to make sure that it's any kind of intervention you work on is grounded in what the people you're working with are saying, rather than kind of what you are focusing on developing an intervention for.
Thanks, Jared. Yeah, I had to take those slides out for the sake of time. For others, Jared is referencing that IDEO's version of design thinking differentiates between divergent thinking, where you're creating lots and lots of ideas, and convergent thinking, where you're taking all the many ideas at once and whittling them down and making choices and decisions. And it's helpful that the design thinking process teases those two processes apart because they're distinct, and gives you tools for how you go through those processes iteratively with stakeholders. And so sometimes you're big picture and you're brainstorming, and then sometimes you're very nitty gritty having to make decisions, and the balance between the two is important.
With that balance, I love the initial diverging thinking of like, throw all the ideas on the wall. And I love the initial converging. I'm the kind of human that I like get stuck on one idea in that initial converging, and it's harder for me to then think broadly in the prototyping process, because I'm like, oh, but we had such a good idea, let's do it. So that in practice has been a like hang up for me personally. I think more broadly speaking to the question, one thing that was really hard for me as I was getting started and figuring out how to apply design thinking is so many of the examples that I was finding are kind of for-profit, more product specific applications of design thinking, which is not the way that I have used it. And so finding like-minded people, which is part of why I was hosting this panel, is so brilliant, but finding like-minded people who are using these really great tools in not a for-profit research and development minded way is really useful, and was a bit hard for me to find at the very beginning.
I will say that the hardest thing for me is embracing ambiguity. I've often described design thinking to folks as a roller coaster where you're going up and up, and that's kind of the part where you're gathering all of these ideas. And then you go through this process where you're like looping and swirling and you have no idea where you're headed. And the looping and swirling part of the roller coaster was and is really challenging for me. I'm kind of person who likes to know where I'm headed and make sure everything is aligned to the big picture. And the way you get really innovative solutions is just to ride that roller coaster. And that's been challenging for me. And then something I've seen, especially with the nonprofit clients that I work with, is the fear of failure, that there's a lot on the line, and there's people's lives on the line, and resources can be allocated to really directly help people. And so it's scary to embrace this process and feel like there might be failure. And I really appreciate that design thinking allows you to practice failing a little bit at a time. So failing early, and then being like, oh, okay, everything's fine. We're just going to make a change and then we're going to keep moving forward, and you get more and more comfortable with that failure. But I know that it's something that is really uncomfortable at first.
So I'll just add briefly on the divergent convergent train. It is hard for me to do divergent thinking, because even in like brainstorming phases, I'm the type of person, I'm like already filtering my ideas, and instead of just writing it down and putting it out there, this is what you should do. And every time I'm able to like get in that mindset, it works out so much better. But it is hard for me to just like put something out there without having already thought 5 steps ahead, just because that is the way that I think through things. So that is personally really hard for me. I know for other people that is a much easier thing to do, but I actually really enjoy the convergent part of it. Like once everything is up on the board, then you can really, to me, it's fun to get through and like, okay, how are these things related? How are they not? What are we seeing here? What were you thinking when you thought of this idea? And then going off of what Emily said, that embracing failure part of it, I think something else that I really enjoy about design thinking is even if you get to an idea and you're like, okay, we think maybe this will work, even if you test it and it doesn't work, then that's still, that idea doesn't work. And the alternative is like, if you're not doing this process, someone thought of this idea, made the solution, funded it, employed people, built this whole program, and then they find out that it doesn't work. I mean, part of this process, you at least know at this point, okay, this is not going to work. So we might not have the right answer yet, but we know that this is not it. So that failure is also a part of the learning that will help get you to where you want to be with that program or with that solution or with whatever that innovation is going to be.
Thanks, all. All right, we have questions coming in, and I'm going to ask the next couple, not expecting that every panelist answer every question. And so going out of order, Zach asked, there are many different exercises design thinking sessions can use, especially in the observation and ideation phases. In practice, have y'all used many different exercises in your work, or are there ones you find yourself defaulting to as go-tos?
I have found that there are certain tools that I use as go-tos. And I will say on a little bit higher of a level, I often find that what folks need is to go through those waves of convergent and divergent thinking, so they'll get stuck. And so I have favorite tools to use at each stage. So when folks are kind of stuck in that kind of convergent thinking, or they're stuck at a point where they kind of know some things, but they don't know where to go from there, I really like doing a quick brainstorm. Everybody takes 5 minutes, walks away, and then comes back and does like a top 5 activity. And I like sorting the top 5 by where they need to head. So maybe we've realized that the biggest constraint we have is funding. So it's the top 5 things we could fund right now, or our biggest constraint is human resources. We don't have enough people. So the top 5 things that the people on this team could launch, and it really helps people to get unstuck. So I found that that's the one I use most often as a tool for going and moving through that convergent and divergent stage. And then in Inspiration, I use card sorts a ton. It's just a really easy way for people to see what's out there and sort it, and you get some cool data. We were talking before about how design thinking can sometimes be not researchy, and that's a cool way to get it to be researchy again. You can get both qual and quant data that way. And then a lot of folks mentioned earlier journey mapping. That's something that I use quite a bit in ideation to help us see from start to finish, what is the customer's journey or whatever client's journey, and how do they, where are there opportunities to intervene? Where do we need to do some brainstorming? Where are there some gaps? Where can we prototype? So it lays it all out really nicely.
I'll just say with our clients, we definitely use a lot of the same things over and over again because all of it's so new. And so we've used empathy mapping a lot. And now like people are getting used to us putting up the empathy map. And so it feels less unfamiliar. I've also used everything else that's already been named.
Margaret, can you share more about what an empathy map is or looks like?
Yeah, it is a fun little visual to really help people think about kind of the environment around someone, what people are seeing, thinking, doing, feeling, hearing, but really to try to empathize with your end user. And so we've used it a lot with health departments, thinking about whether it's their coworkers or their clients, of like when people are in your space, when you're working with them, like what is their experience and what are the different things around them that they're feeling and seeing and hearing and worrying about and excited about, to get at those kind of root feelings behind the thing we're trying to ideate around.
Thank you. Did anyone else want to respond to that question? All right. Sanjivani asked, is design thinking equally effective for products and services? Does it align better with product over service for innovative problem solving?
I'll say I don't know that it's better for one or the other, but I've used it for both. And I think in my most recent project, it was more, I don't know if you would call our ultimate solution a service, but really what we want to be able to do is connect existing networks, which I wouldn't say is a product. Because at least with our project, we were working, so it was their city and county officials who were on our team, or I should say staff that were on our team, but we were working with 9 community-based organizations in Durham, each of which has their own, kind of menu of services and resources that they offer to the community, and their networks within each of those community-based organizations. Each of them had community health workers. Those community health workers are, very connected with people out in the community. But between those 9 organizations, there is not a whole lot of conversations happening. And between those 9 organizations and the local government, there is not a whole lot of, actual like permanent kind of linkages where they could connect and be able to share all the resources and services that are happening in Durham. So I don't know, again, I don't know that I would call it a service. It's not a product. It's this other thing. And really the way we came to, this is what was needed was through all of the interviews, through hearing from so many stakeholders, hearing from so many community members. And I will say, I know at the beginning when I first joined this project, I was not on the initial proposal from Durham, but I know part of the initial proposal was, oh, we're gonna create this website that's gonna have all of these resources. And once we started talking to people, it was like, well, actually, they don't want another website. They don't need another platform. What they need is to be able to connect to the people who can get them the answers that they need. So I don't know that, that I'm gonna leave it at that.
Thanks, Marlene. Did others have thoughts about the products versus service question?
I will add that I've also used it for both. I think it's effective with both. I found it's more challenging with services. I would have to go back and fact check this, but I imagine that design thinking originally was developed around products. And so I found that I've had to adapt, especially in the testing stage, I've had to adapt a lot of what's out there for testing a service. A lot of the prototyping resources that are out there are like, here's how you show them your product in a low fidelity form, and then you would tweak this element of the product. And it's a little bit harder with a service to test the parts of it. But I will say that, especially in public health, I think it's so much more important in services because the services that we create have such a lasting impact and they touch so many people. I guess products do that as well, but I would just encourage anybody to push through any challenges you experience in using this for service, because it's a really unique tool that'll get you to design a service that, like Liz was talking about with that Venn diagram, that kind of meets the desirability, the feasibility, and is sustainable, will last if you use this method.
I'll chime in real quick. That it also doesn't have to be either or. So right now, a lot of what we're coming up with in our prototypes are like tools that would also be tied with a service. And so it's not just like, here is a product. It's like, here, we've made a mural board template for you, and here it's available to you, and we can help you facilitate it. And so it's a combination of things. And I do think it gets really hard in the testing. It gets really hard in like, how do you do a really low fidelity prototype when it's like a human service needed? But I think it's possible, and it's been fun to creatively think that through and think about like, what is our capacity to offer this on a larger scale? And it makes us really think about like our time and effort to make the prototype in a way that it is different for products alone.
And I can add one more thing if we have time. I think one thing I think I've found really effective, whether it's a product or services, that design thinking has helped to uncover the best way to deliver that service or product. So whether it's relationship building is found out as like the best way to deliver it, or like maybe a QR code, maybe a hard copy, maybe an email. I think design thinking also gets at that piece that delivery is equally as important as the product or service itself. And without that, relationship building or kind of build up to that product or service, regardless of how refined the product or service is itself, it might not be successful if those other building blocks aren't set in place.
Thanks, all. We're going to circle back to Amanda's question from earlier. And so again, not all of you need to respond if you don't want to. She wrote, very insightful questions, so conversation so far. Thank you. A question related to collaboration. Are there specific groups, parentheses, communities, companies, boards, etc., that you wish you would have had more access to throughout the design thinking process related to assumption mapping, MVP development, etc.?
Two quick things, just working with health departments. It's been hard to, it's been a little bit of like, we're excited to talk to whoever we can because they've been so swamped during COVID. And so we've not been able to be super choosy about it. One thing that has been a challenge with online facilitation is we are missing people who are not as tech savvy. And there are ways to facilitate around that and make sure that you're not requiring people to be on screen directly interacting with whatever platforms you're using. So making it phone accessible, making, thinking about all types of users. But definitely wish we could have reached less tech savvy people as we're designing often tools that involve technology. So it's been difficult.
I think for the project that I was working on, we were able to engage a lot of the stakeholders that we wanted to through our activities, but I was the only one representing an organization that had community health workers out in the field on the core team. And I think that was more, because my particular project was a part of this, international facilitated mayor's challenge. It was a significant time commitment. So we had weekly 2.5-hour calls on top of individual work that we all were doing outside of that to prep for, whatever thing we had coming up. And that's not something that people can like easily block off on their calendar, especially, again, we were, our end user were the residents that community health workers are connected to, and all the community health workers are out in the field, and all of their supervisors are trying to coordinate and navigate COVID. So I think that is one thing, but it would have been nice to have them more regularly on our core team, even though we were able to engage them through our outreach strategies.
I'll add one more thing quickly. Something that Liz and I saw in a project we worked on is that we got to the end of the project, we were ready to implement, and we realized that there was a whole group missing. And that was because we didn't realize what their involvement in the project would be until the end. Like their role evolved as we got more insights. And so we just didn't have the time to go back and engage them. But a way that I've corrected that in future projects and the projects I work on now is to sit down with a diverse group of folks and just list every assumption I have about the project and where it might be headed and who is involved, and to continue to repeat that process so that you might realize like, oh, I'm making this giant assumption about a group of people who aren't here. And that has helped me to make sure that the right folks are at the table in the future. And it might be that you get to the finish line and you realize that there's a group of people that became involved in the project because of the insights you got and you weren't anticipating their role at first. And so from there, you just try to include them as early as you can, as early as you realize what their role is.
Thanks, Emily. And we have 2 more questions in the chat, and I want to make sure we have time for them. So first, Andy's question, and I think some of you have offered tools, but their specific question is, what's the best or your favorite tool for engaging and getting information from stakeholders? So perhaps from the earlier phases of design thinking, again, what's the best or your favorite tool for engaging and getting information from stakeholders?
Andy, I'm not sure if this is what you're asking, and you maybe can guess this answer because I've been on calls with you before. But I really like using Mural, which is a online whiteboard tool similar to Jamboard. There's like a bunch of them out in the world now. But that is like a platform that I really like to use for multiple different design thinking, kind of to facilitate a lot of tools using that platform. I think it's really useful. You can link to things. You can, it just has a lot of functions that I haven't found as many in others. In terms of specific tools using that tool, a lot of the ones we've already named, empathy mapping, process mapping, or journey mapping. I do a lot of voting. Yeah, Miro board is really similar.
I can add, because I know you mentioned it, Margaret, that Jamboard has been really useful for us. We tried using Miro and found out that sometimes Miro, especially when you're working with different types of internet access, there can be different type of issues. So like if folks are using their phones, certain IPs or tools might not work as well. And that Jamboard, at least for us, was a pretty equal ground, easy to use on a tablet, iPhone, laptop. And you can kind of mold it to a lot of different things. We've used it for like notes, finding themes, having people type in their reactions, setting up like black squares and rows of like 3 each and having people make a storyboard. Like, to me, Jamboard, and it's free. So you just send people the link and they can click it and be collaborating too. So Jamboard was definitely really helpful for us, and you can mold it and shape it into really what you want, which I think is pretty cool.
Thanks. And then the last question that I see is from Yuna before she signed off. And so she's asking and posing a question about the future of design thinking in terms of how employers see it and value it, especially in public health. And she also asked what needs to happen more for this tool to be more appreciated. And so invite any of our panelists to comment on the future of design thinking in public health and how to frame or present it to potential employers.
I think one thing I know that I've learned, I feel like it's more, there are a lot of terms that, or names that design thinking has, like, and I think you kind of need to think through what might be the best way to call it. So like there's design thinking, but also like people might know it as human-centered design. People might not know what either of those terms are, but be familiar with, you know, the process of community-based participatory research, which there are elements within each that align. So I think part of it is thinking through how you explain what design thinking is, or like, I mean, if you're applying for somewhere that's like specifically asking, hey, we want design thinking skills, then I think you can assume that they know what it is. But if they don't, like, I don't think, depending on the term you use, it's not going to be immediately apparent what it is that you're talking about. And I was going to say something else, but I totally blanked on it, so I'm going to stop there.
I will build off of that. I've seen two things. I've seen some folks who are all in on design thinking, and you saying that you are trained in design thinking is all they want to hear, and they want you to take them through the entire process. But I've also seen the other side where it's called something else and they don't want to do design thinking, or they've never heard of it. And so what I would say is that I think that the tools and the mindsets of design thinking are really important and are gaining popularity and are gaining acceptance and desirability. And so what's more important is being agile with the tools that you have and making sure that you can adapt them. I think that's something you heard us saying, is that we had to adapt them online and we had to adapt them for different users or products versus services. And so I think the ability to practice these mindsets, use the tools to solve different problems, whether or not you're calling it design thinking, is really important. I think employers will value that in public health and outside.
I just think like creative facilitation is at the core of all of this. And I think that's something that employers really desire. And I think that's something that the field of public health, like we are in the position to do a lot. And so most of what we do in design thinking is helping walk diverse groups of people through this process. And that's all facilitation skills. And so I think tying those pieces together and showing people the value of design thinking through facilitation, through getting a group of people together and going through a process in unison, is such a helpful piece of this that translates really well to so many components of public health.
And then I was going to answer part of the last part of the question about what needs to happen for it to be more appreciated. I think we need a slight culture shift a little bit. I think as we go through academia and we grow up, we're very product focused. And I don't think design thinking is always churning out products all the time. You might find as you go through your design thinking process that one product might kind of stick, another one might kind of stick, but some of the other underlying factors might be more important than the product itself. And that maybe proposing it to like a grant funder or whoever's, higher up, it might take a little bit of budge and conversation to let that be the norm, because normally it is like, what's your intervention? What's the next step? What are we doing? And design thinking doesn't always work that A to B. So I think in the future, a little more patience behind getting to those tailored results and interventions or programs. And I think through that, we'll probably find a lot more lasting and impactful success with those programs that want to be made.
Can I chime in again on that real quick? That's such a good point. And as we've been doing this with health departments, we've been amazed at just how freeing and new it is to think creatively, because the folks we're working with, they wear way more hats than they should. They don't have time to think creatively. They're never afforded the space. And so they've had to, it's been a lot of training wheels of like, what do you mean we're just thinking and brainstorming and there's no right answer, no wrong answer. And so I think like the field needs to really prioritize and make space for these conversations that are so helpful and so rich. And that requires looking at funding sources, that requires looking at how much we're overworked and understaffed, and really carving ourselves corners to just really think creatively and improve the way we do things. Easier said than done.
Thanks all. Okay, we are nearly at time and wanted to point out that one, I've linked the free Field Guide to Human-Centered Design from IDEO.org in the chat for those of you who would like to go grab it and download it. They also have the website version if you don't want to get the PDF and like the interactive website itself. And then a reminder that Melissa Carrier, Beachy Jagannathan, and I teach 2 sections of design thinking for the public good in the spring semester. And right now we have a wait list for spots. We, Macy can update me, but we have a couple spots in my Tuesday night section from 5:30 to 8:30 left. So if you are interested in joining that wait list, we're working through it in the next couple of weeks. Feel free to fill out that quick Qualtrics survey, and then I will follow up with the recording and we'll send it out to all those who registered. And at this time, I really want to thank our 4 panelists today. I think it's, from my perspective, really cool to see how each of you has taken design thinking and applied it to your work in such different ways. And especially since some of you have just graduated recently, and all of you have graduated in the last 2 years, it's just incredible to see how much you've learned about design thinking and how to integrate it in public health work in such a short amount of time. And so thank you again for your time, and we will connect soon. Thank you, everyone.
Thanks, Liz.
Thanks,
Good to
Liz.
see you all.
Yes,
Thank y'all.
so fun.
Bye.